If you're in your 40s and you're starting to notice changes with your cycle, your sleep, your mood, or energy levels, but you're being told that it's too early for perimenopause or that everything is normal, then this video is for you. Many women enter this phase of life feeling confused, dismissed, or unsure about how to approach their symptoms. So today, I want to walk you through exactly what is happening during the perimenopausal transition, why your symptoms make sense, and how this transition usually unfolds. My goal is for you to feel empowered, validated, and reassured. Let's start by getting oriented, because most women are not taught this framework. On the left side of this timeline are the reproductive years. On the right side of the timeline is menopause. Menopause is diagnosed only after 12 consecutive months without a period. Everything in between is called the perimenopausal transition. Early perimenopause tends to be associated with subtle changes in your cycle due to lower levels of progesterone, and later perimenopause tends to involve more irregular cycles due to fluctuating hormone levels. Having this map matters because without it, women are trying to interpret symptoms without context, which can feel unsettling and confusing. One of the reasons that perimenopause can feel so disorienting is that hormones don't decline smoothly. Progesterone tends to decline earlier and fall more gradually, whereas estrogen, on the other hand, tends to fluctuate, sometimes dramatically, from cycle to cycle. This difference is why symptoms can feel so hard to predict and are inconsistent over time. You might feel relatively normal one month, and the next month, everything's out the window. Understanding this pattern helps to normalize the experience, and it explains why perimenopause doesn't feel linear. During perimenopause, symptoms often cluster into recognizable patterns. Not diagnoses, but common responses to changing hormone levels. Early changes that women often experience include difficulties with sleep, anxiety, mood swings, worsening PMS, and even heart palpitations, especially at night. These symptoms are usually due to lower progesterone levels. Estrogen fluctuations can contribute to things like heavier or longer periods, breast tenderness, bloating, headaches, or more intense emotional mood swings. Later in the transition, lower levels of estrogen may contribute to things like hot flashes, vaginal dryness, joint or muscle aches, brain fog, and changes in libido. Many women recognize themselves in more than just one category, and that's completely normal. Hormones don't act in isolation. Factors like chronic stress, elevated cortisol, inflammation, insulin resistance, poor sleep, or inconsistent movement can all amplify how symptoms are experienced. This doesn't mean that symptoms are your fault. It just means that your body is responding to multiple inputs besides just hormones alone. And many of these inputs are modifiable. And recognizing these amplifiers help to explain why no two women respond to perimenopause in quite the same way. Before talking about testing, supplements, or medications, I always like to start here. These are the foundations that support the body through this change. Nourishing nutrition, stress regulation, sleep and circadian rhythm, movement and exercise, and digestion and detox pathways are all foundational components. But it's important to recognize that even just small shifts in one or two of these areas can have a meaningful impact on the severity of symptoms. Perimenopause is a normal physiologic function, but it doesn't mean that it's always easy. Understanding what is happening helps replace confusion with clarity and self-doubt with validation. So in the next videos, we'll dive deeper into things like sleep, nutrition, movement, vitamins or supplements, and even talk about hormone replacement therapy if or when the time comes. For now, my hope is that you feel more grounded, informed, and reassured about what your body is going through. If you feel comfortable sharing, I'd love to know what symptoms are you experiencing most right now in the perimenopausal transition, and what questions do you have? I'm Dr. Kate. Thanks for being here, and I'll see you in the next video.